Rod Crocker loved to fly. He put in more than 1,000 hours soaring in his glider over Canada and the U.S. Then 2 years ago, a degenerative spinal condition and meningitis left him paralyzed from the chest down. That loss of mobility and chronic pain now dominate his life. He believes people in his situation should be able to ask a doctor to help them die, even though he wouldn't do so himself.
Having the option eases your mind a bit. And even though you don't want to take it yourself, you know that further down the road, it does give you some assurance that you have some control at the end and that you are just not going to be left to suffer.
Ruling on a case brought by a woman who later went to Switzerland to legally end her life, Canada's Supreme Court said doctors must be allowed to help terminally ill or desperately suffering patients die. The federal government brought in legislation that provoked rowdy scenes in Parliament. It passed the lower house, but is now stalled before the upper house, the Senate.
Because it's a moral issue, this speaks to a matter of conscience. You know, it's not like voting on a budget or not. You're dealing with life and death issues.
Opinion polls show most Canadians support some form of optional physician-assisted dying for those facing pain, dementia, or stark physical decline. That's why some advocates oppose the current bill, which they feel does not go far enough, and they hope the country's Senate will amend it or send it back to lawmakers in the lower house for reconsideration.
We expected that the Supreme Court of Canada's decision would stand on its own. We didn't expect that the government would draft legislation that doesn't meet the minimum standards of the Supreme Court of Canada's decision.
From Monday, Canadians will have the option of physician-assisted dying, thanks to the Supreme Court striking down earlier laws. What they won't have are the conditions that the federal government proposed in this bill, restricting the choice to die to mentally competent adults facing certain death from their condition. It's now up to legislators to decide whether to pass a law that the court would allow or leave the decision as a private matter between a doctor and a patient, as it is for now. Daniel Lack, Al Jazeera, Toronto.